Sometimes after a virus, or sometimes you get an injection, or the original swine flu injections, there was a condition called Guillain-Barre Syndrome. What is Guillain-Barre Syndrome?
Guillain-Barre Syndrome is an inflammatory disease of the nervous system. It seems to be an autoimmune response. That is, a response where the body's own immune system begins to attack the nervous system in a fashion which causes slow, progressive paralysis. It's a temporary condition where the paralysis will progress over a 10-day to 2-week period, even to the point where you may need to be intubated and placed on a respirator, a breathing machine, to breathe for you because your own muscles are too paralyzed to breathe for yourself. It's a temporary condition which, if you take the proper precautions and proper treatment, then over time will reverse, and the vast majority of patients will come back to their previously normal self as the condition resolves.
How does it present? What would be the first symptoms of it?
The first symptoms are a feeling of weakness and easy fatigue, which usually begins in the legs. It reaches the point where it becomes difficult to walk, then difficult to stand, and the neurologic impairment, the difficulty with the nervous system, progresses from the legs on up to the trunk to affect the breathing muscles, the arms, and the chest wall. The extent of the illness dictates what kinds of treatment, whereby when you get difficulty extending as high as the chest wall and the breathing muscles are affected, that's the point where the patient is intubated. There's certain medications and treatments that you can use to try to slow or limit the spread of this disease and help the disease to reverse itself more quickly.
If a person has Guillain-Barre syndrome, are they contagious with anything?
They are not contagious. It's an autoimmune disease, as I've said, whereby the body's own immune system is attacking the body. It does not seem to be caused specifically by any one infection, but rather the body's interaction between the infection and their own response.